Okay, so some of the things that you guys want to know for this exam coming up, I'm going to go over this first and then we're going to do the Jeopardy game. So you guys, I know that we talked about medication administration and the rights, the 6 rights of medication administration, very back on our first exam, but these are things that you are going to frequently see on tests because you're not in the, and I decided to add them into this exam because you are not in the clinical setting and you're not giving meds. So I want you to be familiar with that. So you guys should know your proper checks that you guys should do for med administration, and you should know the rights of med administration. We talked about antidepressants, and we said that when we were teaching our patients about antidepressants, that was really important to let them know that that the patients, once they start taking the medication, would not see an immediate effect. We said that it would take a little bit of time to see that. Do you guys remember how long we said it would take? Dina?
4 weeks. 4 to 6 weeks.
Oops, sorry. It's okay. I'm sorry. No, that's okay. You guys are just so used to blurting it out. It's fine. 4 weeks. Very good. You guys should know why we don't consider barbiturates the main treatment for anxiety anymore. We talked about that. One of the medications you guys need to know is Librium. You guys want to make sure you know the nursing interventions associated with Librium. I'm going to have to get up here probably in about 6 or 7 minutes because I got to run and grab something out of the oven, but then I'll be right back. You should know your passive and active immunity. You should know your vaccines, nursing interventions for your vaccines, when they would be due, what class of people would get certain vaccines. We talked about different barrier defenses that our body has that help us prevent infections. You guys need to know that. You guys need to know about Parkinson's disease. With regards to narcotics, you want to know about your narcotics, the different types of narcotics, and then those priority assessments. What are our priority assessments going to be for a patient on narcotics? Okay, Dina.
Their respiration and their level of consciousness.
Yep, and we're going to look at blood pressure and heart rate. Yep, very good. You guys should know about your anti-seizure medications. We talked about one in particular, phenobarbital. We did talk about, when we talked about general and local anesthetics, we said that there was a particular reason why we combined lidocaine and epinephrine together when we gave them a injection. Do you guys remember why? And if you don't remember why, you guys need to go through your slides and find out why, because we talked about it.
Ms. Davis, you said what? Combine what?
We combine, sometimes when we're giving lidocaine, we combine it with epinephrine. You guys should know your tricyclic antidepressants. You guys should know your sympathetic responses in the body and your parasympathetic responses, what manifestations we would see in the body. You should know your benzodiazepines. Definitely some information on there about inflammation, how it presents in our body, why we have it, what purpose does it serve. You guys want to know about Xanaflex or tizanidine? That's a muscle relaxant. Also, what deficiencies in the body cause depression? Whoops. We talked about histamine release in the body. You guys should know why that process happens, what the purpose is. I want you guys to know about Haldol, or haloperidol is the other name. You should also know about Ambien, which is also lipidem. When we talked about inflammation, we talked about those white blood cells that we would see the most of in response to any type of inflammation in the body. Do you remember which ones in particular they would be?
Neutrophil.
Neutrophils, yeah, very good. You guys should know about Lamictal. You should also know about your SSRIs. Interactions with your MAOIs. You guys should know about side effects related to vaccines, rheumatoid arthritis, scopolamine, which is that little patch that goes behind the ear. You guys should know about that, especially your patient teaching. You also want to know about your anticholinergics. All right. So if you guys can't stay, that's fine. We're going to do the Jeopardy game now. So what I will do is I will call on different people. So looks like almost everybody is here. I'm trying to figure out who isn't here. That's probably easiest. And it's okay if you don't get the right answer. That's how you learn. When you get the wrong answer and then you hear the right answer, you're like, oh, okay. And then you don't forget that again. So let me just take attendance real quick just to see who's here. Okay, Amy, I saw you.
Here.
Cindy?
Here.
Basola?
Yeah.
Heather, I saw you. Sophia?
Yeah.
Raven? Yes, I see Raven down there. Kelsey, I saw Kelsey. Loveline?
Yes.
I saw Ashley, Brianna, Ryan, Martha Lynn, Sarah? No Sarah. Kathy?
Here.
Tazra, I saw Tazra. Shanoa, I saw Shanoa. Dina, Dashana, she's here. Emmy? No Emmy. Renee, I saw Renee. Maureen?
Yes.
Chizoma? I saw Chizoma, I think. Yes.
Here.
Chanel? No Chanel. Okay. Shabria?
Here.
Monica? I saw Monica. Alan?
Here.
Verlina? No Verlina.
Here.
Oh. Okay.
I'm
Oh, there you are. I wonder why you don't come up on here. That's
Oh,
weird.
you didn't hear me?
I heard you now, but your name's not coming up on here for some reason. That's weird. Okay. And then Kelsey Bigler. She's here. Okay.
I'm here, yeah.